Hello, I'm Dr. Deed Harrison, Director and owner of Chiropractic BioPhysics Technique. What I'd like to talk to you about on this video is a new cervical orthotic device called the Denneroll. The Denneroll is a product out of Australia designed by a Dr. Adrian Denneroll from Sydney, Australia. The unique design of the Denneroll orthotic device assists in the rehabilitation of the cervical curvature that should be present in the neck from the side. Shown on the slide is the normal natural curve that should be present in the neck. The white circle represents the area that we're looking at. Here is the normal cervical curve in the neck. The green line shows the proper curvature that should be present. Shown on the right of that is an abnormal cervical curvature called a reverse cervical curve, and the red line shows the abnormal shape of this cervical column. The Denneroll device was designed to rehabilitate or restore the natural cervical curvature. Many times people that lose their cervical curve due to accidents, injuries, and poor work habits will experience neck and upper back pain or headaches. This slide shows the pain patterns that can be present in somebody's neck, head, and upper back when the cervical curvature is reduced. The circled areas show the different neck joints, and then the lines where they go into the colored distribution maps show the areas that the neck can cause pain. For example, the lower neck, called joints 6 and 7, can cause pain into the shoulder and shoulder blade region. People feel the pain in the upper back, but it's coming from the neck. This slide shows us that spinal arthritis and disc disease can occur when the neck curve is abnormal for several years or decades. On the far left is the natural cervical curvature here, where the person is looking to your right. The green line represents the normal cervical curve. Stage 1 or level 1 shows an abnormal cervical curve with the red line showing the path of the neck and the green line showing the normal curve. Over time, we start to experience progressive spinal arthritis and disc disease in the neck. For example, if we look at level 3 and level 4, you can see destruction in the vertebra and the discs due to an abnormal neck curve over time. Now, this can be associated with a myriad of health disorders, from neck pain to arm pain to sometimes organ dysfunction. The Denneroll device started out as a round circular top. After testing this device on patients, the evolution of the device went to a unique shape with a lip or a ridge at the top of the Denneroll device. This ridge is very important in rehabilitating the cervical curvature. So what you're seeing on this slide is the development over time of the Denneroll shape. This is where it started, and this is where it has ended up today. The Denneroll device comes in two sizes: a small adult white size and a large adult gray size. The size difference is approximately 1 centimeter or 10 millimeters. Smaller adults or non-flexible adults will get the small Denneroll device. Larger adults or flexible adults will get the large Denneroll device. Shown at the bottom of the slide is an x-ray of a patient's neck from the side with them lying on their back with no Denneroll on the left. You can see that the cervical curve or neck curve is now reversed in this region. With application of the Denneroll device in the lower neck region, you can see that the device has restored the natural cervical curve. There are 3 primary positions for placement of the Denneroll device that your doctor of chiropractic will decide which one is best for you. The Denneroll can be placed in the upper neck, in the middle neck, and in the lower neck or upper thoracic region. The placement of the Denneroll device depends on the unique shape of the abnormal neck curvature and the postural position of the head when looking at somebody from the side. For example, on the far left, we see an abnormal curvature where the neck joints are behind the natural red normal curvature that should be in the neck. The Denneroll device will be placed up in the middle or upper neck region, the cervical region, and it will push this area of the neck forward to match the red line. So the example set up here is in the mid and upper neck, forcing a curvature to occur over time in this region. Over here we have a straight region in the mid neck region where the Denneroll device will be placed in the mid or maybe even part of the lower neck. This allows this area of the neck to bend backwards, and it allows the top of the neck to move backwards to where it matches this red line. On the far right is a different type of cervical curve or neck curve where we have abnormality that starts in the lower part of the neck. Also, the top of the neck is very far displaced forward relative to the bottom part of the neck. So if you look up here, this point on the top of the neck should be backwards here on this red line. What we'd like to do in this particular case is place the Denneroll device in the very bottom of the neck or even at the top of the rib cage or shoulder region. This allows a proper curve in this area, and it allows the top of the neck to move backwards. So in summary, the Denneroll has three placements. Only an X-ray and a postural analysis can show which one is right for you. A couple cases of before and after X-rays of patients that have used the Denneroll device. These patients have neck pain, headaches, or upper back pain to start with. On the left is the initial X-ray. The green line shows the normal curve that should be present in the neck, and the red dashed lines show the abnormal curvature that is present in the neck. On the far right, we see the X-ray of the same subject after using the Denneroll for a period of time. Case number 2 shows a similar outcome, a very nice improvement in the shape of the natural neck curve after proper application of the Denneroll device. In a study that we did on 9 consecutive cases, we showed that the Denneroll device was able to restore the natural curvature in the neck by up to 10 degrees after only one session. It also brought the head posture back to a more natural position as viewed from the side. What we ask is that patients use the Denneroll device under the instruction of their chiropractor. The chiropractor will determine which one of the 3 setups is right for your unique neck curve abnormality. You will receive a log to record dates and times of application of the Denneroll. It's your responsibility to do your Denneroll sessions at home and record the time. Times start out at 1 to 3 minutes and progress up to 10 to 20 minutes. It should be done at least 3 times a week at home for a period of 9 weeks. We want to see 3 times a week minimum at home for a period of 9 weeks. It can be done more frequently, but that should be determined by your doctor of chiropractic. After you've done an adequate number of sessions on the Denneroll device, your chiropractor will request that you return for a second follow-up radiograph or spinal X-ray. Then we can see the results of using the Denneroll device. Thank you for your attention, and I hope that you find the Denneroll device comfortable and effective.